some medical students and even general clinicians struggle so hard to take history for people who are having epilepsy. But in today's video, I'm going to show you how we can do history taking while managing people with epilepsy, and this will help improve on how you manage this patient of epilepsy. So if you are still new to our channel, I request you to subscribe because this motivates us to make more content for you. So this video is good for you if you're a medical student, if you're a general clinician, you're a general practitioner, you're a medical worker, and also you are someone who is working in a hospital setting. Okay? When you are doing history for epilepsy, is that we divide it into 3 phases. Okay? The first phase is called pre-ictal phase. Then there is what we call the ictal phase, and the last phase is what we are calling the post-ictal phase. Okay? So when we talk about the pre-ictal phase, this is the phase we want to look at some of the things that happen before someone getting an attack of epilepsy. Remember, epilepsy is a sickness which is characterized by someone having recurrent seizures. So what happens before this person gets an attack? Like you can ask the caretakers, okay? You can ask the people, the observers, okay? Before this person gets an attack, what really happens to them? Okay, so some people can maybe get a flash of light. Okay, they have what we call aura or warning sign before they get an attack. They see a star, they see a dark. Some maybe others can be making a sharp noise. So this one helps us to properly diagnose these people and also to properly manage them. That is during the what? The pre-ictal phase. Now you have to find out what really happens. Does it come when this person is having a fever, or it comes by itself when there is no fever? Okay, because we have seen that most people who have high fevers, for example in children, they can develop what we call febrile convulsions. Okay, but for this particular case, we want to rule out even other sicknesses. That is during the time of pre-ictal phase. Now the ictal phase, this is during the attack, like during that epilepsy. What is really happening during that time? So we want someone to describe for us, like if a patient is narrating a story, some of them may lose consciousness during that time, they don't know what is happening. Okay, so you ask them, how do the people who see you collapsing, falling down, what do they say about you? Okay, someone say maybe they see me convulsing, maybe shaking, urinating in my clothes, or the saliva. Okay, because this happens when these people are not aware of what is happening around them. Okay, so you ask them about what the observers see. Okay, what these people see them when they get an attack. This is during the ictal phase. Okay, or during the attack. Then from that time onwards, like how long does it take? Like if someone is convulsing, how long does it take this person? We are looking at the duration of the what? Of the seizure, okay, or the convulsion. So of course we have different types of epilepsy. We have what we call convulsive type, where someone can shake maybe one part of the body or both sides of the body, and we want to discover, is it generalized type epilepsy, which is having like someone is having the whole body shaking, or it is focal epilepsy. Focal epilepsy is where the seizures are originating from one part of the brain. It can be the right hand side, it can be the left hand the left hand side. So we have convulsive type and the non-convulsive type. So there are certain types of epilepsy where someone does not fall down, but just loses consciousness. I mean that just loses consciousness or awareness for some time. Okay, so we want to rule out, is it convulsive or non-convulsive type? During this phase, we are saying that people who have what we call generalized type of epilepsy, that you find them describing for you that I shake maybe the left hand side. So every time someone falls down, it will be this side which is shaking. okay, or the whole body which is what? Shaking. They can be telling it takes maybe around 5 minutes or what, then you know that I'm dealing with what? Generalized type of what? Epilepsy. But if someone describes for you, say, someone loses senses and is not aware what is happening, maybe regains it back, then you know, okay, this is it, non-convulsive type of epilepsy, or I'm dealing with what we call absence seizures. Okay, so during this time also we are trying to look at how frequent are those attacks. Okay, how frequent, how many times do they happen in a day, do they happen in a week or in a month or in a year? This is very good for you to for proper management. Like you may be initiating someone on what we call anticonvulsant medicine. So want to find out, are this medicine effective in controlling the attacks? So it is very important for you to find out how many attacks, how many seizures that this person gets in a day, in a week, in a month, or in a year. Okay? Then also, these seizures, what provokes them? Is it fever? Is it when someone is having any other sickness or any other thing? Okay? So we want to know the duration of that attack. Then we have already talked about people convulsing, others do not convulse. So you have to do proper history taking. So if the patient is not aware, please do not hurry to diagnose someone is what? With epilepsy. Okay? We want someone to have at least 2 recurrent seizures within a calendar year, which are not provoked. We mean that they should not be caused by any physical illness or fever or anything. They should come by themselves, because this is epilepsy is caused by, it is characterized by what we call recurrent seizures. Okay? If you are new to our channel, we request you to subscribe. We are inviting people to come and partner with us. If you found this information is helpful and also you are interested in mental health, we welcome you to partner with us, continue supporting our mental health activities. We are carrying out mental health outreaches here in Tororo, having mental health clinics. Okay, we want to continue going to Nachivale to support those refugees in Nachivale refugee settlement every month, because since the US stopped funding, most of these people, they do not have a psychiatric clinical officer like me who can go and assess them, diagnose and give them what? Treatment. So we want to welcome you on our team. You may support our team. Our contacts are just there, and we shall be grateful. We need drugs. We need mental health drugs. We need the transport to go to the communities to carry out community awarenesses, dialogues. We need the money to go on the radio talk shows to continue sensitizing people about mental illness, because majority of people here in Uganda believe that mental illness is caused by witchcraft. So if they believe that it's caused by witchcraft, most of these people are going to witch doctors who are eating their money, who are eating their cows, and they are selling a lot of their things. So by the time they come to the hospital, they have wasted a lot of resources, and even the patients have worsened. Okay? So mental health is a fundamental human right. So any health support that you give us, it will be very important. So as we continue, the last phase of epilepsy, while we are taking history, we are saying that this is what we call post-ictal phase. Now, what happens after someone has gotten an epileptic attack? Okay? Some of these people can go into deep sleep. You find someone sleeping. There are those people who become confused and they start moving up and down. They cannot understand what is happening. Okay? But there are also those people who can just become like people who are, okay, like psychotic, just a bit of confusion. Okay? So this one is very important in that you will be able to support this client, you will be able to support the family which is affected. So after this history taking, rule out things like substance abuse, you rule out things like physical infections. So maybe someone has malaria, someone has been abusing substances. Is it caused by an accident? Is it caused by what? So rule out these things so that you can come up with a proper diagnosis. And remember, these people are always stigmatized in their community. So counsel the patient, counsel the family members, Okay, then write for them medications, and always we begin with a monotherapy. When you are starting someone on medication for convulsions or for epilepsy, always begin with one drug, then you keep on titrating the dose until you reach the maximum maintenance dose. Okay, so if this information has been helpful, please subscribe to our channel and also share it with other people so that they can also get this information, but also you can partner with us. Thank you.